morning, everybody. Thanks for being here. I'm Dan Tsai, the Director of the Department of Public Health here in San Francisco. I'm joined here by my Deputy, Dr. Navina Baba, as well. Today, as always, each month we will go over the latest overdose numbers for the city and talk about some of the progress that we've been making here. I want to thank the Office of the Chief Medical Examiner, as always, for quickly providing us this really important information. So getting straight to it, the overdose numbers for uh, September of 2025 were 38, 38 people. That, as context, is the lowest number on a monthly basis this year, and it is the second lowest number ever since the Office of the Chief Medical Examiner started tracking overdose deaths in 2020. That 38 is 7% lower than last September and lower, as I noted, than any other month this year. That's still 38 too many people that have died of an overdose of a public health crisis and epidemic. But I want to say I am encouraged. I'm encouraged. I know we're making real progress. And I and others here are not yet satisfied about where we are and the work that we continue to have to do. And so, to that end, I just wanted to play back some of the things that we have been, as a city, focused on and making progress around. Particularly, three areas I want to talk about where we're working hard, doing things differently, doing things with common sense, and I think seeing progress. And so, to really understand a lot of what we, as the Department of Public Health, also with this administration as part of the city's efforts, I just want to highlight three things, which, when I talk about it with friends and family and others that are not deep in it with us, all seem like common sense, but they really undergird what we're doing. And the first is when we see the amount of conditions on the street, people actively using, in need of medical care, in need of behavioral health care, in need of services. The first thing we've been focused on is much more proactively being able to engage those individuals in the street and quickly connect them to some immediate stabilizing service, a place to be, or care within the first 24 to 48 hours. That's piece one. The second piece is once we can get them, folks, to some place with some level of stability, being able to quickly help folks move into some sort of treatment setting or to be able to get clinical treatment medical services. Third, once we get people plugged into treatment, we know we often lose folks, sometimes because it is too difficult to get from one part of treatment and care to another. We want to help folks more successfully be able to continue and succeed in their treatment and recovery journey than otherwise. And so, on each of those three things, I just want to note a few pieces. First, on quickly getting people from the street into some care or stabilizing services, I want to talk a little bit about our collective street teams and our street health teams, which we've spoken about the new neighborhood street teams, where the city has taken 9 different independent street teams previously across departments and put them together in one coordinated effort with many departments all acting as one. That has been a clear directive from the mayor. And I want to share a little bit about what that's been like for our team on the ground from a health standpoint. First, I think for the first time, we are seeing a new level of collaboration between departments that's actually allowing us to help get folks who many departments are engaging with many, many, many times quickly into services, into shelter, into care. I was talking to a nurse on my team the other day who was mentioning prior to this new neighborhood street team configuration, how difficult it was sometimes to get somebody into even a shelter for someone that has touched the system 10, 20, 30, 40 times. Folks that we know we absolutely want to be able to get plugged into care, into shelter, and to really be able to provide services to. And with this reorientation in different departments, including health and housing and emergency management and others working together in a different way, that process is much, much, much easier. And while there are growing pains for sure, that level of collaboration and focus is working. It's encouraging. It's exciting. I also want to note that our teams are out there both caring for individuals on the street and doing everything to be proactive and helping to offer and provide treatment and services. And we are seeing people be able to get plugged in, including in the middle of the night, into treatment and services. And that always is a very exciting thing. And we're seeing that every single day. The second piece of that, again, the lights have just gone off here, and they're back on. That relatively common sense piece is, okay, once we can get somebody plugged into treatment, let's say they're at one of our crisis stabilization centers at 822 Geary, for example, that we've just recently opened, we want to be able to help get them into the next place in their journey. And so we have recently opened over 270 beds, new treatment and other related beds for recovery and around what we call a whole continuum of starting straight off the street and into treatment and into a recovery and sober living situation. We also have open new crisis stabilization. We've also been adding much more case management and behavioral health supports for folks with a range of complex addiction and medical needs in shelters, where the thesis being we've got folks who are really sick. We help house them and shelter them. We should be providing services while they're engaged there instead of looking for them on the street. And the final thing I want to note, that third part, which is what we always call stickiness, which is when someone is plugged into care and treatment in some way, how we help them successfully move through that journey. We have become much more intentional about all of the different case management and coordinating activities, so that when we've got somebody plugged in someplace, we're doing everything possible to help them move through that journey. We still have a ways to go, but that's an incredible focus, and we have been seeing success, and that is very encouraging. So with all that to say, I think I am encouraged, optimistic, and not yet satisfied about the 38 overdose deaths this month, which is the lowest number this year and the second lowest since the numbers started getting tracked in 2020. And I think with that, we will take any questions folks have. Natalia.
Yeah, so, sorry. Last week's hearing with the treatment on demand report, you mentioned that wait times are still around 3 days for people to get into recovery programs. I guess the uploading of new beds, like how else are you trying to reduce that wait time?
Sure. I think there's a few pieces. One, for many of the folks with that wait time, say for residential treatment, we're able to quickly get them plugged first into withdrawal management, which is where they're essentially detoxing while they wait for bed. That is a very effective way to get somebody someplace with services so that they can then move into a 3-month to 6-month treatment setting. The second thing we've been doing that just started rolling out about a week ago is we took a hard look at some of the administrative requirements before someone is able to enter treatment. That was contributing to that several day wait, and we have changed that process. So historically, we have required a clinician before admitting someone into treatment to do a whole very extensive clinical assessment of somebody in order to determine if they are eligible for treatment. We know those folks are going to be eligible. We have since modified it to be essentially a 5-minute screener. If that screener is yes, they can enter treatment, and then they can finish out some of the other clinical evaluation over the next several days and weeks, which is what you want to have happen. We want to reduce the barriers when someone is motivated to enter treatment to make it easier for them to start, and then we will help figure out the additional details once they've entered the program. Anything else? Questions on the rain? No. Thank you, everybody. Thanks, Navina.